Welcome back to another episode of With Love Mama, the podcast. I'm Tanika, but before we dive into today's episode, I just want to say a huge thank you for being here. This podcast was created to feel like a safe space where women can exhale, feel seen, feel informed, and feel a little less alone in whatever season they're moving through. So if the conversations that we've had have supported you in any way, one of the most beautiful ways that you can support the show is by subscribing, leaving a rating, or sharing an episode with another woman who needs to hear it too. It genuinely helps our podcast to grow and reach more women navigating preconception, pregnancy, birth, postpartum, and beyond. So let's get into today's episode. Welcoming Alicia to With Love Mama, the podcast. How are you going today?
Hi, good. How are you?
I'm so good, and I'm really looking forward to this conversation because we've had a few birth story guests come on and chat about their different journeys through pregnancy into their birth. But something that really, I guess, was highlighted for me with you was that big baby story and your journey with gestational diabetes. And I'd really love to touch on that today. So did you want to take us back to the moment that you found out you actually had gestational diabetes and what was going through your mind?
Oh, it was a whirlwind when you have such a low risk pregnancy to start with and everything's going fine, normal. I had no other symptoms whatsoever. And then bam, you've got diabetes. You're just like, oh no, you feel like you've done something wrong. You feel like you're not eating right or you're not drinking right or there's something that you've done wrong when you are doing everything right. So I kind of felt a little bit defeated, what have I done? But there's nothing that you have done. There's nothing that you've done wrong. It's just when I found out the amount of people that actually had it, I was like, okay, that made me feel a bit better.
Yeah, definitely. And
Yeah.
what gestation were you when you found out?
I would have been third trimester.
Mm-hmm. And up until then, did you have much of an awareness around gestational diabetes or have any signs that you may have had it?
I didn't feel any signs of having it. Whenever I had my scans done, they're all yep, everything's going fine, everything's going well, it's tracking fine. And then obviously towards the end, he was a big baby when he came out. But I had to have a test done at the start of my pregnancy because it kind of runs in my family. So when I did that, I was like, and it came back negative. It's like, oh, cool, everything's fine. Don't have to worry, don't have to stress, didn't look into it at all.
Yeah, and then you would have definitely been on that almost false high, I guess, of oh, I really don't have to worry, I really don't have to stress. And then it would have felt, I'm guessing, a huge shock when you actually had that positive result.
Yes, yeah, it was. Yep.
Yeah.
What do I have to do now? And there was a lot of questions moving forward. They were very fast compared to others because I did jump onto social media and I was like, oh, has anyone had any diabetes that can give me a hand? Any question, any feedback? What have you guys done with it? And a lot of people were very set back with theirs. There was a lot of waiting, but mine actually was put through quite fast considering I've went through public. So considering that too, I was like, oh, it's actually not gone as slow as everyone else's kind of stories. Obviously everyone else's is different. So that's why I was kind of like, oh, this is actually okay. But then just towards the end, it kind of picked up a little bit. So I was a bit more worried then.
Yeah. And did your pregnancy experience change after that?
Yeah, I was more like, oh, I have to be strict now. I have to watch what I'm eating. And I when you get the insulin packs, because I had to go through insulin in the end, they make you log everything. So I had to watch what I was eating. I have to do this, I have to do that. And I was already stressed as it was being third trimester, nearly there. And I'm like, oh, this is just too much for me.
Yeah. And did that bring up anything from even your past with eating or anything prior to pregnancy?
Yeah, I felt kind of watched and more put on. I felt like put on notice, which is in a good way because when you're obviously pregnant, you're automatic. First one, you're automatically going to be like, yeah, I'm going to stick to this. I'm going to do that. Not going to eat this. I'm going to eat the safe foods. Make sure I'm on track. But then with the diabetes, in the end, it was more pressure, and I was already like, oh, this is getting a bit too much now for me. So in the end, I was like, oh, cheeky here, cheeky there, bit of no go foods. But when you're pregnancy mode, your brain's just like, I need that and I have to have it now.
Literally.
So that was me as a pregnant woman. I saw something on TV and I'm like, oh, they're going to cook that for dinner.
Mm-hmm. Yeah. And I feel like that feeling, like you said, of being just like watched almost, of like, um, very much so like the monitored is a great word, I guess, like being
Yes.
monitored through everything. That
Yes.
is like so, it's like, oh my gosh, what if I, like, it just creates so much self-doubt and so much extra stress. So I can
Yeah.
imagine that would have been like towards the end of your pregnancy, that happening. It would have been quite a lot, and it would have been quite hard not to, you know, fall into your comfort foods, even though you know
Yeah.
that you shouldn't have been doing that. Um,
Yeah. Yeah.
but it's a very
Yeah.
real thing, like you said, that you experience, that I'm sure a lot of women do experience of like, oh my gosh, you're almost like stripped of everything. Because like food is a huge comfort for a lot of people. And also, a lot of women have struggled like in their past with like, portion sizes or what they're eating, or
Mm.
this is good, this is bad, and all of the things. So I feel like it would very much, and I'm not meaning to put words in your mouth, but highlight all of that when,
It did. Yeah.
especially when your hormones are at the, like you said, you see something, you want it.
Yeah. Yeah. You're at your peak, like, oh, I need
Yeah.
this now. Yeah.
So, with like that and like your diagnosis with gestational diabetes, what conversations sort of started happening with your care team around your baby's size and growth?
For some reason, I just kept getting told, no, he's tracking fine, he's tracking fine. And then it got to the point of the plan where I had to see the gynecologist. I can't say that word properly, but is it the guy? No. Anyway, I had to see like another doctor, and he put like the ball in just to see if I was dilated, and then he tried to see like the size, and that's when he said, "Oh, we might try and book you in for induction just in case." And
Mhm.
when you're hearing those words, you're like, "Oh, they're big words, and they're kind of scary." And they're like, "Oh, hopefully I don't have to come to that."
Mm.
But also at the same time, your adrenaline's rushing. And when you get to that point in pregnancy, you kind of just do want like the safest way possible. And you do want your baby out because you're just like, oh, you've had enough. So yeah, all those sort of things were happening. And I had way more scans. I had more scans than what I was going to be having. And that was more exciting because I was told like towards the end, you probably won't get any scans after the kind of the set ones. And I was a bit sad. I was like, maybe I'll just book myself in for some. But being high risk, there was more scans. So I was like, yeah, I can see my baby a bit more.
Yep. And do you feel like that like created like a bit of fear and pressure around your birth, like the talk of induction and just like the, oh, like we might have to go this way and all the things?
And the not knowing, yeah, it did. Yeah, yeah.
And what was
But in
your,
my frame of mind, sorry to cut you off, but I was more that person that was like, whatever the doctors are going to tell me and whatever they also recommend, I'm just going to agree to as well. Because being for me the first time, I was like, I also didn't get labor, so I didn't feel anything. I didn't have that instinct straight away, which I know it's odd to say, but I had a parent who, like a friend of mine, she's had 3 kids, and she's like, you might not get any of that. You might not feel those instincts, and when you have your child, you might not feel that motherly instinct straight away. You won't get. Sometimes you won't feel straight away like I know what I'm doing, but I didn't get that. So I was just like, yep, whatever you're telling me, I'm going to do.
yep, yep. And that's like so fine. And I think that's actually a beautiful thing to bring in as well, because there's like is like that huge narrative around like, oh, when you meet your baby, you're going to feel like that instant like euphoria and love. And for some people, it's actually a completely different experience, but it
Yep,
doesn't take away from the bond that you end up building with your child or anything.
yep.
So did you have an actual like plan for your birth prior to finding out about gestational diabetes that you wanted to follow?
Nah, nah. I just did. I obviously every woman where I don't want to pigeonhole, but I would say every late woman that is pregnant and gives birth wants to do it natural, wants to give
Yep.
natural. So that was my frame of mind. I'm like, if I can go natural, I'll go natural because that's the way it's supposed to be.
Mhm.
That was what was put into my head. Like, hopefully you can go natural. There's obviously other ways to give birth as well, and all those sort of things. I was like, yep, if that's the way it's going to be, then I'll do that as well. If that's, comes to that, then that's fine. We'll do anything that the doctors are going to recommend to get my baby out safely as well. It was weird because he was actually a really big baby, so I was sort of hoping to go into labor beforehand, but he didn't want to come out at all. So yeah, we did the induction, and yeah, it kind of didn't really go to plan, which I didn't like. Now when I look at it, I'm like, I should have been a bit more scared and worried than what I was. But in
So
that moment, I was just like, what's going on? Oh, okay. If it's a bit sore, why? And then all the doctors are rushing in, and I'm just like, oh, what's
yeah.
going on here?
So did you feel like prior to your induction, and we will get into your birth story in a moment, but did you feel informed in that, or were you kind of just more like going with the flow of what the doctors were saying and weren't asking too many questions?
They filled me in quite a bit, so I felt like I didn't have any questions. And looking back now, I still didn't need any like questions asked. I was just, like you said, going with the flow. Whatever they're telling me, they already told me what it's gonna do, what it's about, what happens after that, all the stages prior and after. So I felt really informed. It just, yeah, it doesn't go to plan sometimes.
Yeah. So speak us through your experience and how that did actually feel for you going in for your induction. And you mentioned like things going wrong. So talk us through your birth story and how that felt for you physically and emotionally.
Wow, while we were waiting for the appointment, I think that was the most like I would say nervous part of it. Me and my partner were waiting for quite a long time to get into the appointment. And we were just sort of sitting there going, oh, is there something that's going wrong with already? Like we were kind of setting ourselves up to fail. I think there was so much going through our head. I'm in pain. Like I wouldn't say in pain because of labor, but just in pain in general. Like I didn't want to sit for too long. I had to keep getting up um, and then when we got in there, that the whole process of the balloon, I had gas, so I didn't feel too much, but it was still painful enough to be like, oh, that's really, really uncomfortable. I did not like that at all. And I think because I was trying to fight the gas, being like I could feel it and it was uncomfortable, that's when like his heart rate started to drop. And after the balloon was put in, they make you wait half an hour before sending you home,
Mhm.
and then you got to come back the next morning to get it taken out. But because his heart rate was dropping, my heart rate was dropping and going up, like it was pretty like low and then going up and dropping again. I felt a lot of pain to one side. I clicked the button to have the nurses come in, but they were rushing in straight away regardless because they can monitor you from outside. So they
Yes.
could see what was happening, and they came straight in, and I was like, oh, that was the most nervous part too. There's a whole team of people stuck a drip in me, and everyone was like, are you all right? It's happening. Everything's okay. You can calm down now. It's all good. Heart rate's okay now, but you might have to stay in now overnight. So I didn't have anything with me, had no bag, had to get my partner to go home, come back. So all that planning that you do just sometimes just goes straight out the window. It doesn't matter how much you pack, plan, nothing goes to plan.
So from here, your induction then didn't progress. What, like once the balloon was removed, I'm guessing, didn't progress. And like, how was that starting to feel for you?
I was getting really nervous, really
Yeah.
nervous. I honestly thought I I didn't think anything was wrong to the point of they would come in to say you're gonna have a C-section. I just felt like what like nothing's happening. What's going on? Like, have I done something wrong? Have I taken something I shouldn't have? All those thoughts go through your head. And it got to about like a couple hours into having that balloon taken out, the water's breaking, and I just thought, oh, that's not right. I should be in labour now.
Mm.
And then I came back to sit down. They came back to monitor me, take my monitors off and on. And then I think 20 minutes later, they said, yeah, you're probably going to have to come in for a surgery. We'll do a surgery in the next half an hour. But they said it so nonchalant, and the gas was pretty much kicked in at that stage. So I was like, oh, cool. Yeah, let's go. My partner was just like, what?
And how did that feel for you? Because your son ended up weighing like 4.3 kilos. Is that right?
Yeah. Yes. Yeah. He was big baby, and he ended up in special care for other reasons. And when we're looking at all the other children, all the babies in the nursery, we're just like, why is he in here? He's like the healthiest baby.
Yeah, yeah.
Yeah.
So how did that feel? You know, you went in, your induction wasn't progressing, and then
Yeah.
you shifted to an emergency Caesar. Obviously, you were a little bit airy-fairy in that moment, but your
Yeah.
partner was a bit concerned, and then your son was taken to special care. How did that feel?
It was like a whirlwind when going from you're going to have a C-section. My mind just wasn't registering what was happening, and I was more feeding off my partner, so he was worried. So he was, then I started worrying. I'm like, oh, maybe we do need to be worried. Like my brain, we do need to be worried, but I didn't want to make anything else more stressful, like especially if like his heart rate was already going up and down. I was trying so hard to be as calm as I possibly could to make sure that the C-section went like how it should go. So when they said that straight away, I was like, oh, I'm going to need an epidural because I need to calm down. And it was like really, really fast. I remember laying there, not being able to really move much. The epidural really took over. And I'm just thinking, this is a good song. And I just tried to be as calm as possible. Like there
Yeah.
was really nothing in my head going on towards what was actually happening. my body and my mind was just straight to gotta be calm, gotta be calm, gotta stay calm, try and be still, get this baby out so we can finally meet him and everything will be okay.
And did you feel that sense of relief once your baby was up on your chest? Like,
Yes, as
you?
soon as he came out screaming, I was like, thank goodness
Yeah.
he's okay. His cord was around his neck, so that's why they wanted the C-section. But as soon as I heard him, I was like, oh my God, thank goodness. I can hear him. Everything's fine now. We can all stop stressing. No more nerves. Everything just went away as soon as I heard him. And he, yeah, definitely came onto my chest. And I was like, oh, this is that's the euphoric feeling that everyone talks about when you finally get to have your child with you.
Yeah, after such a journey to meeting him as well.
Yes.
So, touching on your son going to special care, was that for long?
So he was born on a Friday, excuse me, and they had to test him for diabetes. So they do 3 pricks on the foot.
Yeah.
And he failed every single one. So that was number one reason for going in. And he had a tiny infection in his blood because they take some blood out after the C-section just to test it. And yeah, he had tiny little infections, so we had to have antibiotics. And he was taken that Friday evening, and I don't even remember them coming in to take it. I was still coming off the epidural and I had endone for pain. So I was still just like, my parents were in the room and I'm chatting with them, and all of a sudden the baby's gone and I'm like, where did he go? Oh,
Yeah.
he left like half an hour ago. And my partner's trying to explain and he filled me in. So then he was in from the Friday. We left the following Wednesday.
Okay,
So
so
we were
that's
in for nearly a whole week.
yeah. And how do you think that impacted your postpartum journey at all?
That was the most like stressful time. Like I would put that the most stressful time over the C-section, only because they only let you stay obviously the 2 days when you have a C-section.
Yeah.
So I was like, we only live 5 minutes away, but I didn't want to leave without my baby. I'm like, I'm not leaving. I don't want to go and come back. Like I've just had a C-section. I don't want to be like going in and out of the car a lot. So me and my partner were both stressing so much about where we're going to be, how we're going to go, like if we're going to go home, do we get to stay? So they did end up putting me up in the border section to board.
Mhm.
They still took like all your they could still come in and check you, but they don't give you your pain. Oh no, they did give me pain meds. It was just they didn't give me food, which was fine. I was like, I don't care. I can go days without eating. I just need to be in this hospital so I can be near my child in case something happens, the antibiotics doesn't work, anything like that. So that's what I was most stressed about. I was very adamant that I wasn't, because they were trying to say, look, we can see you only live, around the corner. I'm like, oh, it doesn't matter where I live. I
And
want to stay right where my baby. I'm not leaving this hospital until we are all going home together.
And I think
Um,
as well, like it's so easy to say that, but when
mhm.
you're growing your little human, they're right here. The intimacy is something that can never be matched again once they're outside of the womb. But
Yep.
you being like, oh, you can just go home and have a shower. It's like, no, 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 they're literally a part of me.
Yeah.
Like,
Yeah.
so that's so valid to feel that way of like, no, no,
Yeah.
no, I'm not like, it's all good. Like, my partner can go home and shower. He can go home and
Yeah.
get some more supplies, but I'm staying here.
Yes.
So I'd love to finish on what would you tell a woman who was just diagnosed with gestational diabetes, has the fear around the big baby narrative, and is already, now fearing birth, induction, and all of the things?
I would suggest trying to do some like good research into it before going for your test, just to get your hand around what happens afterwards, and make sure that if you do end up having it, that you're like kind of advocating for yourself a lot. I feel like I didn't advocate for myself a lot towards the end when they were really pushing, and I had a lot of pressure towards the end, making sure that I was doing my insulin properly. But at the same time, I was like, oh, I have so much going on. I don't want to take all this on at the same time. But yeah, like I said, just make sure you're advocating for yourself, regardless if it's gestational diabetes or whatever your high risk issue is. Just advocate really hard for yourself. Make sure you do your research and try not to stress. As much as hard as it is not to, is to do, just, yeah, try relax.
Yeah, and that's honestly the best advice that there is of just being informed, being as informed as possible, but also keeping your nervous system as relaxed as possible, not jumping into the fight or flight and worst case scenario. It's easy to do, but it is
It
extremely
is.
unhelpful.
Yes, yes, exactly. Let
Thank
your
you.
partner do that.
Literally. Thank you so much for coming on. I really love that conversation and a lot of insight into your journey with one, gestational diabetes, but also the special care nursery. That was just a really great, insightful birth story. So thank you so much for joining us.